My name is Courtney Van Houtven. I am a professor at Duke University in Population Health Sciences, the School of Medicine there. Mostly US focused, some European focus as well. So I study how we can better support family members and friends who take care of older adults or adults with disabilities who can't remain in their home independently without some assistance. So trying to figure out interventions that we can scale up at the health system level as well as policies that would better support them so that they can have better outcomes over the long term and that they are able to provide high quality of care in the home. In the US and probably most of the world, family caregivers, or in the UK, you call them carers, are kind of the main providers of long term care and are kind of the key to avoiding institutionalization or having to enter a care home. So in the US, most three-quarters of people with disability mainly use informal care, either alone or in combination with care from formal care providers in the home. There's been a lot of lip service, I would say, to family caregivers over my career, so like 20 plus years. But lately, there's been a much more interest in passing laws to expand training. We actually have a national caregiver strategy that was passed about 3 years ago. And so there's like 300 recommendations of how we can better support family caregivers through trainings, through workplace accommodations, through not cash benefits and not expanding formal home care, unfortunately, but there are a lot of recommendations on how we can better support them so that they have better outcomes. So I think they are being implemented, but there's no funding behind them. So that's a real stumbling block. But I think as more research comes out that shows that there are cost savings to health systems, specifically, if you support caregivers, then it leads to them being able to stay in a less expensive form of care, that there are expansions of those supports because health systems are realizing like this is actually going to be a good return on investment. And it's also very, I guess, important to have the caregivers integrated into the community. And some of the trainings are really to help them find other people and remain less isolated. And that helps their outcomes. I feel like universal long-term care insurance, we have failed to have that passed, and it could be hugely beneficial to people to have some sort of private-public partnership and having truly universal long-term care coverage. Expansion of home and community-based services would be a big part of that. So I think that's kind of number two. Maybe it happens separately from universal long-term care, but we're doing more and more research that finds that the expansion of home and community-based services not only meets the preferences and needs of the people who need care, but it also frees up their adult children, lets them remain working, lets them have better economic outcomes of their own. So that's number two. And then the third one would be to really have substantial benefits, maybe things like pension credits for caregivers. This is pie in the sky. This is never going to happen in the US, but this idea that caregivers who are workers retire too early and then have their own poverty and old age, if we could find a way to give them credits in the social security system, that could go a long way to alleviating bearing this really high cost of providing all of this unpaid free care that keeps the US long-term care system running. You know, women are the modal providers of care, both informal care and also formal care. It's a lot of low-income immigrants, women of color, providing the formal care, and so it's not a priority to support women. It's just sort of viewed as their role to be the care providers. So I think if men were the modal providers of informal care, there would be policies to address it. Well, for sure, we've done research where women are the main people who have ill effects in terms of their economic outcomes, and men don't. Like the female workers have the worst outcomes in terms of caregivers. So, you know, it kind of bolsters this idea that we need to invest in caregiving if we want women to work for longer and remain as building the tax base for governments, et cetera. I think solutions, again, to support caregivers, things like offering employer firm solutions, like having private companies offer paid leave policies, expanding home and community services, trainings if you want them. Kind of more flexible work is actually a really interesting strategy. So starting to evaluate what's that done for workers who are caregivers. Does it help them maintain their caregiving role and their working role. So I think those are some of the things that I'll be looking into next. I think in terms of informal care specifically, it's understanding, we know a lot about the average effects. We know it's women, we know it's across the life course of that bad outcomes we're having, but very, I think fewer studies have looked at like what are the particular subgroups who are really doing worse. And in the US, that would definitely be people who are minoritized racially and ethnically, people who are in rural areas, like people without as many resources. If you're low resource going into your caregiving role, there's some evidence that they have worse outcomes. That's pretty common sense, but being able to tease out kind of the heterogeneity of effects and also what supports are better for people that are higher at risk rather than just on average rolling out supports, because a lot of times people who are more resourced are the ones who get the supports and they're the ones who need it least. Although, of course, it's good they have them, but targeting resources to people who are at risk of the worst outcomes, I think, is the next frontier.